And thank you to everyone who has joined us from the various media outlets that we've got running here in the room right now. The reason we're doing this is because we know people have questions about the Moderna vaccine. And in Dawson City, at least, whenever we have questions about something like that, we go to Maria-25Feb21, who's our public health nurse. She's a source of calm, rational wisdom and information, and someone that we trust in the town. We thought, working with the One Yukon folks, that it might be nice to take her savvy out to the rest of the territory and anybody else who might be interested in what she has to say about the Moderna vaccine. We have gathered a lot of questions from folks who have submitted them prior to these sessions, but you can, if you got an outstanding question that you'd like to ask while we're chatting away for the next hour, there's a couple of ways that you can do it. You can go to slido.com, so SLIDO.com. You'll be prompted to input the number 84109, and it'll take you to a question board that you can just type in your question. You can also contact us via Facebook Messenger, either at the Maria-25Feb21 Facebook page or the Trying to Pitch In Facebook page, where Hän People is standing by to read your message. Most of the questions that we have, I think, probably are the same ones that you might have anyways. But again, thank you for joining us. It's great to be here on the traditional territory to try and pitch in to answer whatever questions you might have from wherever you might be coming from. And with that, I'd like to hand it over to Maria.
Thank you, Wayne. And thank you everybody who's joining us today, or if you're joining us later, watching the recording, I'm glad you're here. And I'm going to try my best to answer questions that are pretty common. And if you have more questions, we'll talk about how maybe those can be answered as well. So I'm going to start off what I've done locally here in Dawson when I've done some info sessions about the Moderna vaccine that we have in Yukon is started off with a little information about what Moderna mRNA vaccine is and how it was made. So Nathia, our host, has a picture that she's going to show us, and I'm going to walk us through what that picture shows us and what mRNA vaccines are. mRNA are letters that stand for messenger ribonucleic acid, and that's part of a genetic sequence of the coronavirus. mRNA is also in our bodies. Our bodies have information in our DNA, and they send messages to different cells with something called messenger RNA. It's like a mailman, sometimes people have called it, sending messages to cells about how to make things. So with viruses, bacteria, they also have DNA and they use messenger RNA as well. This mRNA vaccine type of thing has been worked on since the 1990s. It's since they were really doing a lot of genetic sequencing and learning a lot of new things about DNA. The scientists that were studying this were thinking this would be a great way to communicate with our immune systems and use it to fight off enemies to our bodies. And one of those enemies now we know is coronavirus. It's gone into humans and we need a way to fight it off. And so since this has been studied for almost 20 years now, there's already been some trials used in different manners. One of the exciting things is that mRNA vaccines have actually been studied very closely on how to treat cancers. And that's exciting news because current cancer treatments, though some of them are successful, they can also be very challenging to our bodies. So using something like this might be a really neat way of targeting specific cells. So mRNA gives a specific message to our cells about how to make something. So using this as a vaccine, when we heard about coronavirus back last year, and in China, they were looking at what it was and actually did the genetic sequencing of the COVID-19 virus. That was shared with the world, and people who work at Moderna and at Pfizer who were working on mRNA research took that genetic information and started looking at how they could use that in their vaccine platform. One illustration I have used in Dawson to explain why things have happened so quickly with mRNA vaccines is, think of this mRNA type of technology as a cookie dough that you might have in the freezer, just a plain cookie dough, no flavors in it necessarily, but we could pull it out of the freezer and we could stir chocolate chips one day and have chocolate chip cookies, and then another day we could stir in cranberries and walnuts and have a different kind of cookie. So in a similar way, this platform has been studied and had already really been manufactured and tried actually in humans before in different ways, just not with the coronavirus vaccine virus. So this picture shows at the very top a picture of the coronavirus with these spikes sticking out. That's why it's called coronavirus. It's like a crown kind of. And when scientists looked at the coronavirus, they thought, that spike protein is going to be a way that we can recognize the coronavirus. It's kind of a signature look it has. And sometimes I think about my friends that I know in Dawson that wear their winter gear in the wintertime, and you can't necessarily see their faces, especially this year with masks too. But I still recognize, the bright pink snow pants of my friend, and I know that that's who that is. So in the same way, our bodies need a way to recognize the enemy, coronavirus, when it enters our body. And the spike protein is one way that we can do that. So scientists looked at that spike protein, and then they synthesized the genetic information about how to make a spike protein, not the whole virus, just the spike protein, and made that mRNA and are using it in a vaccine called mRNA vaccine. So in the next, as we follow this kind of half circle down, you can see this wiggly worm looking thing with this thing sticking off. That's the representation of the messenger RNA that's in the vaccine. The next circle with the purple little bubbles around it is fat particles that are coating the mRNA. We need this fatty coating around this mRNA because it's very fragile and it needs a way to get to our cells and to attach to our cells. So this lipid coating is used to coat this fragile mRNA as it goes into the vaccine. And this is one reason that we have to be so careful with mRNA vaccines, because this lipid coating is very fragile. That's why it's frozen so cold, and why we have to be very careful when we thaw it, how we handle it. We're very careful with how we carry it, even when we're at a vaccine clinic, that we don't shake it. So it's a very fragile vaccine. We put it into our bodies. The lipid coated mRNA gets to our cells and attaches to our cell, and it just puts the mRNA into our cell. Now that does not go into the middle of our cell, the nucleus, and it cannot change our DNA. It just sends a message to our cell about how to make spike protein. So something that I learned that I didn't know before is how when we infected with any virus, a cold virus, influenza, or coronavirus, the whole virus actually gets inside our cell, hijacks our system, and makes our cells make more of them. So it's kind of like, an alien invasion where it comes into a factory and says, okay, you're going to now make a whole bunch of robots for our army. And in spite of ourselves, we are forced to make this virus. So in the case of the vaccine, we're not forced to make the whole virus. We are just asked for a short period of time to make just the spike protein so that our body will recognize our enemy later, the coronavirus. So you can see near the bottom of this picture, the blue cell, that's our cell with the mRNA deposited inside there, the recipe for making just the spike protein. And it starts making these spike proteins and shows it to our body so that we can learn about it and learn how to fight it. And then at the bottom of the picture, you can see the cell has these spike proteins. We're showing it to our body, and then our body is making those Y-shaped pink antibodies so we can fight off coronavirus later. So the antibodies is our goal. We want to have antibodies so that the soldiers are ready to go when coronavirus in the real thing might show up on our doorstep, and we want to be able to fight it off. So thank you, Mathia, for showing that picture. Appreciate that. The one thing I didn't share earlier today was about that fragility of the vaccine. I don't know if people have questions about why we have to freeze them, like Pfizer vaccine that we don't have here is frozen at -70, and the Moderna one we do have here is frozen at -20 when it comes to Dawson. It comes frozen in the plane, and we are very careful to thaw only what we need for the day. That's why we're really careful about who can be scheduled or who's dropping in. We have to make sure we use every single bit in that vial, or we have to throw it away. We can't keep it till the next day. So at the end of our day, we're really careful too at how many people are coming into our clinic. And that's going to affect us later too, as we have vaccine eventually in our communities, is how are we going to deliver that? And are we going to be able to schedule that easily? So that's going to be a challenge in some of the smaller communities. And we're looking right now at how we're going to do that in each community. It's going to be different in Beaver Creek than it will be in Dawson, and it'll be different in Dawson than it will be in Whitehorse, but we'll make sure that all Yukoners that are eligible get a chance to get vaccinated. Another question that people have, if it's okay, I'll go on, Wayne, with this, is the speed of how this vaccine was made. So I talked a little bit about the cookie dough already made, ready to go, and we could just stick the genetic sequence into it so we could get it ready. That's one of the reasons that it was so quickly able to be manufactured. And that's why mRNA vaccines from Pfizer and Moderna were at the head of the pack. They were the first ones to kind of finish because they could turn on a dime and just do the genetic sequence into the vaccine. Other manufacturers are doing their vaccination processes in different ways, or their vaccine production in different ways. And some of them have to actually make coronavirus before they can manufacture their vaccine. So it takes longer for that to happen. That's one of the more traditional ways. There's actually quite a few different versions of vaccines that are being studied and manufactured and are asking for approval. But in Canada, there's only mRNA vaccine right now, and in Yukon, there's only the Moderna one. Another reason that the vaccines were able to be made so quickly is because we are so concerned about the coronavirus pandemic. It's affected everyone around the world. And so governments have been very ready to open the money pockets and give vaccine companies some money so that they have the materials and the time and the manpower to actually fund the manufacturing of this, and so that we can be ready to go as soon as possible. So money is one issue. Usually in scientific research, it takes a long time to get grants and to convince people that this particular thing that someone is studying is really valuable. And it takes time also to recruit study participants. And that is one thing that there is certainly no shortage of in our pandemic, because we have COVID circulating around the globe. Thankfully, not very much in the Yukon, but it is quite, active in many places in the world. And so it was easy to find a place where there was risk for COVID, and it was easy to find people that were willing to volunteer to be participants as well. One of the key things when you study something is you have to make sure for a vaccine that someone's actually exposed to the disease before you can prove that it works. Here in Yukon, if they had given a bunch of us vaccine and then waited around for COVID to show up, it probably wouldn't have worked very well, because we've been so fortunate we haven't had much COVID. But in the States and in Brazil and different countries, they've had lots of circulating coronavirus, and so they've been able to study it and prove very quickly that it works well. One thing that people often ask is, well, with all this speed, did the government actually do all the safety checks? Did they have to do everything correctly? And absolutely, yes, they did. Governments did get ready, though, to receive data from these companies early. So they were reading papers early. Usually these vaccine companies or someone who is maybe getting a medication approved have to put the whole package together and have it all neat and tidy, and T's dotted and the I's, T's crossed and the I's dotted, and have all the package ready to go as a whole. But in this case, Health Canada and the FDA in the United States and other countries were saying, give us that raw data quickly. We want to review it right away. As soon as you have it hot off the press, we want to know right now what's happening. And we don't want to wait until everything is completely done. We want to start reviewing it because it takes some time. They want to pick those papers apart very carefully. And they had to go back to the manufacturers and ask more questions and ask about this and that and the other thing. So they were very, very careful about how they were reviewing that data. And they didn't just do it casually. It was a very important job that they had to do, and they did it very carefully. And they will continue to review. We have a really rigorous way of tracking what happens after immunizations are given. We are required to report anything that is not expected. And so I'm involved in that system here on the ground level in Dawson. And then it goes up through the line. Dr. Hanley's office looks at things that happen in Yukon that we didn't quite expect, or we ask questions, is this normal side effect normal? And we review those things. And if there was ever anything that we did not expect and that was concerning, that would go quickly up the line through the Yukon to the national level and actually to the international level, because we want to be able to respond quickly if anything concerning happened. The good news is that millions of doses of Moderna vaccine have been given around the world, and it's an amazingly, it's so effective. It's like 94% effective, and there have been no serious reactions to it. Certainly there are some anaphylaxis that is sometimes happens. It's rare. I have not heard of any of that happening in Yukon, but it could, because any medicine, you sometimes have that chance. But broadly, there has not been any red flags or concern, nothing that was unexpected. And I'm very happy to share that with everybody. And we will continue to watch that. Health Canada is requiring Moderna to follow their study participants for 2 years. So they will continue to report data back to Health Canada and to other countries as well, because we really want to know more about how the first people that got this vaccine started back in the summertime. How did they respond long-term? How effective is the vaccine? Because they're the ones that have been have had it the longest, and we'll continue to look at that data. There's also, 40,000 people were in this study. 20,000 of those got the vaccine. We also need to look broadly, globally, when we give vaccine, how does it work in the real world when we give it to many, many people, and how does that affect the transmission of coronavirus? So that's one of the big questions I know that's on our list that we want to cover. So I'll stop talking for a little bit, Wayne, and take a deep breath, maybe get a drink of water.
So you won't be not talking for long, Maria, but thank you for that introduction. I'm going to share a couple of the questions then that we've received from both. And if anyone again has anything that would like to fire our way, you can send it to us via Slido, slido.com, input 84109, and type out your question. Maria, what's the difference between regular approval for a vaccine and another approval issued under the Emergency Measures Act?
That's a good question, and it's something that I had to look up to understand a little bit more about that myself. So when there is something like a pandemic going on and there's something that's needed quickly and we want to make a difference in people's lives and prevent deaths, then there is an opportunity for people who are working on treatments, and in this case also vaccines, to put forward some products that they have proved are safe, but that have not been used broadly yet. And the approval process can be compressed a little bit. So in Canada, Health Canada has issued emergency authorization, but it comes with conditions. So I know that these are available for reading if anybody's interested on Health Canada's website. There's interim order conditions, I think is what it's called. And so you can read exactly what Moderna is going to continue to have to do to prove that its vaccine is safe and effective. They're going to continue to have to provide data. If they build a new laboratory, they have to prove that that laboratory or their manufacturing plants are safe and clean, and that they're following all of the specific things they need to do. And Moderna will continue to provide information. So if they would change anything about their vaccine, they would have to report that. So for instance, there was a little bit of a change in the type of vial that they were going to use, and they had to report that to Health Canada. They couldn't just do it and just say, oh, by the way, we just stuck something different in the box today. So it's very specific that they have to be really on the ball, and they're really held accountable by Health Canada for that.
Great. I'm going to ask another question. So did we answer earlier on the question around the stage of trials?
I don't know if we did, but we are not any longer in any trial. We are in the stage, really, it's not really a stage of research at all. We are in the regular use of a new vaccine, and it's not considered a research stage, but we do collect some data, because there's no way that a group of 20,000 can prove that we can stop transmission because it's such a small group compared to a country. We really have to see it in a country or a province or a large place like that. So for instance, Israel, who's done a really good job already at vaccinating, now has been able to start looking at what their data is showing and sharing it with the rest of the world about what they're seeing about transmission. So those kinds of information is really, it's impossible to have that type of information when you're doing research with in a vaccine trial. But that's the information that we want to know in the real world now, is how that actually works. So in a vaccine trial, they have to prove that it's effective enough and then it's safe. And then when we say effective, we're talking about someone who will not get really sick from COVID and that had positive tests to antibodies in their blood. So we can't prove that transmission can stop until we have it given more broadly. So that's why that question is still not answered, because they couldn't answer that in a study. There was also a question, sorry, about when we talk about the manufacturing, someone was asking if somebody can access the published animal trials for Moderna. Now, as far as I know, the animal trials would have been done back in like 2015, maybe even earlier than that, maybe even in the 1990s, there were some. But if anyone is interested in looking at Moderna data, Moderna actually has a website that I think you can access some of the stuff. I didn't have time to dig real deep, but modernatx.com is a place to look if anyone has real interest. But I would warn you, it is written from a research standpoint, but so it's quite complex language. Health Canada has really good stuff as well if you're looking for some sources. And the Moderna monograph is on Health Canada's website, easily available to everyone. So if anybody has complex questions that you want to have answered and you understand those types of papers, have at her.
Great. So there's some light reading for the weekend. Here's a question we heard from a number of people, and that is, COVID is like a bad flu for most people, and 98% of the folks who get it recover. So if this is true, why should anyone take a risk with a new vaccine when our systems will likely fight off the virus on its own? Isn't it better to let our body's natural immunity fight the virus rather than drugs?
So I know that's a common question, and really our immune system is our friend usually, and it can help us with more mild illnesses. But this is what we call a novel virus, and so we have very little experience fighting off this virus, and we are seeing really, really serious illnesses from it. So in Canada, the stats are saying that 1 in 13 people who have been diagnosed with COVID are actually having to go to the hospital. So I'm not great at fast math, but I think it's about 8%. And then 3 out of every 100 people that are diagnosed with COVID die. So that's pretty big. And I was explaining this morning about how when I multiply that out for the Dawson population, that could be like 66 people in Dawson possibly that would die of COVID if we just let it go and let everyone get COVID. So I'm very concerned about that kind of number, and our healthcare system in Dawson is great, but it couldn't handle that. And I would remind everybody that COVID hospitalization would probably not in the end happen in Dawson. We'd probably have to send people to Whitehorse, and the really sick patients would have to go on to Vancouver. And then you think about, all that funnel of medevacs to Vancouver, and Whitehorse has a lot of people living in it. We would end up with a healthcare system that was overwhelmed and couldn't care for people. So that's one reason why, back in the early days, everybody was saying flatten the curve, because we didn't want to see such huge numbers overwhelming our healthcare system. So that's one important thing. And then the other thing is that influenza does not have nearly the severity of infection that we see with COVID, not nearly as serious as COVID infection. And I know there's lots of debates out there, but there are some really good data out there about how severe it is. And then there's this concern, Wayne, about the long haulers, the people that have gotten COVID, have been hospitalized with it, have been seriously, seriously ill. And then they are discharged, they've survived their illness there, but they're finding that a large number of people are having some long-term symptoms from that. And finding that they aren't just jumping right back up into getting back to work or back to their normal lives because they're being affected by that. So that's really concerning too, because we may end up with folks with some chronic diseases because of this as well. Now that you were also asking, I think, about why don't we let our immune system just fight it off on our own? So the neat thing about vaccines is that our immune system actually just gets a little help. Instead of having to fight off the coronavirus, the big guy, we can actually be ready for him. So it makes sense in, why would we not practice basketball if we were going to have a basketball tournament? We would, of course, practice so that we could learn how to play basketball before we actually have to play basketball. So in the same way, our immune system, if it has to fight off coronavirus, it's really better to teach it how to do that and teach it how to do it well before we are exposed to coronavirus.
Full disclosure, regarding the basketball analogy, Maria is an Ohio Buckeyes fan.
It's true, but maybe more football than basketball, but they've got a good basketball team too.
Maria, what would you say to a young person who is healthy and wondering why they should get the vaccine if they've probably got a much stronger immune system than, say, an old goat like myself?
When we talk about vaccinating folks, and this brings up the idea of herd immunity. So there might be people in our community that are young, healthy, and strong, and would maybe weather a COVID infection just fine. The concern is that there may be a chance that your body will not actually keep that immunity from a natural infection. So that's one concern, that you might be prone, maybe you could possibly get the infection again. We know that that has happened in some cases. And we also are concerned that if someone has COVID, they could maybe pass it on to someone else who actually is more vulnerable. So maybe, let's use a general cold even. A cold infection for one person could be minor, but for someone who has a lung disease, that could be a major issue and actually cause some pneumonia. So for COVID, if you have a mild illness and you don't know it and you pass it on to someone else who is very vulnerable, that could be life or death for them. So we want to try to get as many people immunized against COVID so we don't keep passing it around and giving COVID infection to someone who's really quite vulnerable and could die from it.
Speaking of that, does getting the vaccine mean a person can no longer pass COVID or coronavirus on to other people?
So we are hoping so, but we don't know that yet. And that's why we're really watching carefully places like Israel and eventually in Canada. How are we doing now once we have a high rate of vaccination? Is it preventing transmission? And that the reason we're keeping these guidelines like the masks and we're making sure that we're 6 feet apart here is that we don't know yet how well this vaccine is going to prevent transmission. We hope it's going to prevent it. We see in other immunizations that it does prevent, immunization can prevent and does prevent transmission. The hope is that we are going to see really low viral loads, it's called, so that the less viral material we have in our bodies, the less likely we are to pass it on. We already know this is true for COVID. For people who have little to no symptoms, that it's much less likely that they're going to pass it on. Certainly not 0%, but much less likely. So we're hoping with vaccination that we were going to lower the viral load so low to maybe not getting it at all, that we won't be transmitting it to other people anymore.
Great. Another question we had came up quite often is a question around how effective is the vaccination against the virus?
So in the study for Moderna, they had to prove that it was effective against preventing severe infection and death. So in the study, 20,000 people got the vaccine and 20,000 people got the placebo. It was just salt water, basically, sterile salt water injected into their arms. And then they had to see in the group that just got the salt water, did they see serious infections from COVID? And in the group that got the vaccine, did they get serious infections from COVID? And in fact, no one died, I don't think, from COVID in the vaccine group. And there were a fair number of people who got very seriously ill from COVID in the placebo group. I don't have the numbers in front of me, but it was really striking. And that's why they are saying that with 2 doses, Moderna is 94% effective. It was actually even higher, but in scientific research, you can't ever say it's 100% effective. So there's something called a confidence interval, and those statisticians out there, sorry if I'm butchering statistics, but that's kind of the way it works. So Moderna did an awesome job, and Pfizer was right on par with it as well, with their mRNA vaccine. With 1 dose, they saw about 80.2% of people were showing some good immunity. And with the 2nd dose, it went up into the 90s. So that's why we really want to have people get 2 doses. The other thing around 2 doses is that when you get 1 dose, it teaches us about the coronavirus, but our body might not remember it as well the next time we're exposed to coronavirus. So just like learning your multiplication tables, you don't just learn it one time when you're done. You have to go back and review it again and again. With our immune memories, we also have to be reminded. And so we know generally in immunization world that 2 doses usually boosts our immunity and lets us keep it for way longer. So if we want to remember it for a long time, we're going to have to be reminded, and that's what that 2nd dose is about. Not only bringing up our effectiveness for ourselves, but also being able to remember for long term. And I don't know how long that's going to be yet. We haven't seen that yet, but we hope it's going to be a long time.
That maybe is a good time to ask this particular question about whether or not, what if a person doesn't get that 2nd dose? Would you be more prone to getting the virus?
You might be. We don't know a lot about that yet, but we do know from the study that the effectiveness was lower with 1 dose than it was with 2. Over time will tell. There are other immunizations that continue to be studied. Like I'm thinking about Gardasil, for instance, the HPV shot. We used to give 3 doses to some age groups, but they've been studying it in certain age groups, and it looks like actually we can give 2 doses now. That's what we do now with HPV. So over time, we may be able to find more information that we can maybe change our vaccine schedule. But for now, what we have, and we want to protect the North as fast as we can, we're doing 2 doses because we know that that does work, and we want to do what we know works instead of just guessing.
We had a question from someone or a concern who really hates needles, hates going to the doctor. Does this vaccine use a big needle? Will it hurt? And how long will the needle be in my arm?
Well, if I give it to you, it won't be in the arm very long. My philosophy is the faster the better, with carefulness, of course. But a needle is not in your arm very long at all. And I've had a lot of great feedback from patients I've already vaccinated with Moderna mRNA vaccine, and they've said they really didn't feel it at all. They're actually quite amazed. So I can encourage you that it's been rare that it hurts a lot. Also, I could encourage you that the diameter of the needle is exactly the same as what I use for a baby. Usually it's even the same length as what I use for a baby. So it's pretty small. It's 25 gauge if you know what that means, and it's really tiny. So I would reassure you that it's not that big a deal. Now I know when I'm the one giving it, that's different than the one that's receiving it, but we try to reassure you too. And if you have a lot of anxiety around immunization and getting injections, there is an opportunity for you. If you need to lay down, we can do that. And we want to be as reassuring as we can. So reach out when you're at the clinic if you're concerned and say, hey, I'm just feeling really nervous. Can you please help me out with this anxiety and talk about that? So we want to make sure that we're helping you as much as we possibly can.
Okay, we've got a number of questions that are coming in, and I just want to make sure that we take as much time as we need to answer them. So I'm just going to, if these come a little buckshot splatter from all different directions.
I'll do my best.
Thank you. We had a question from someone in the Pfizer vaccine trials. 4 people got Bell's palsy.
Mm-hmm.
This particular individual has had Bell's palsy twice. Is there a chance they could get it again from this COVID vaccine?
So there's 2 different parts of that question. So the first part is about the Pfizer vaccine, which we don't have here anyway, but in that Pfizer study, the rates of Bell's palsy in people who got vaccination were actually no greater than what they would have expected might have happened anyway in the general population. So if you don't know what Bell's palsy is, it's usually something that is, it happens and then it goes away. That's called transient. And it mimics a stroke symptom. When I've seen it in patients, it's often been in their face, where maybe one side of their face droops, they have a little numbness or can't feel that side. Maybe they're stumbling around with their words a little bit, but that tends to go away. And I think it's been associated with viral illnesses. But like I said, in that Pfizer study, they did document some Bell's palsy, but it actually had not occurred at any greater rate in the people who were getting vaccinated than the people that generally that live and get Bell's palsy anyway. So it wasn't a concern that the vaccine had increased the number of Bell's palsy people in that group any more than what they might have expected if that nobody had gotten a vaccine at all. Now, for this person particularly who's had Bell's palsy twice and is concerned about that, I would suggest that they talk to their healthcare provider that knows about that history, or explain it to them. And maybe there's something in their history specifically that they need to address or have that discussion. So it'd be important for those kinds of cases that are a little bit more complicated to have that conversation with your doctor.
We have received a question from someone who has had extreme vertigo 3 times, and they now suffer with dizziness on a daily basis. Is dizziness a side effect of the vaccine? Can the vaccine cause vertigo?
It's not listed as a side effect at all. And so I would reassure that person that no, I don't consider, from what I have read and what I've been told, that vertigo is a side effect of the vaccine at all. That is a difficult thing to deal with, but I wouldn't expect that this should be causing more vertigo. It certainly has how do I say this? There is a possibility that you could get some side effects that are not vertigo and may make you feel not well, but it should not specifically increase your vertigo.
We know that side effects, of course, we hear a lot about them on the news lately. Folks want to know how they can expect to feel after the vaccine, especially because it seems some people get ill after getting the second dose.
So we have seen, after first doses, we've seen some local reactions, some soreness in the arm. That's very common. It's interesting with this vaccine, sometimes even a week or 2 afterwards, sometimes there's a red itchy area on the arm there. That seems to be a normal thing, and we aren't concerned about that. Also, sometimes people's lymph nodes, which are connected with our immune system, have done some swelling and had some discomfort under the arm or nearby, sometimes on the collarbone area. And that's also not a concern unless it doesn't go away. It really is a sign that our immune system is starting to do its job and react the way we want it to and create some antibodies. Now, I know sometimes people would say, well, then if I didn't get any side effects, does that mean that my immune system isn't doing its job? And that's a good question, but actually in the studies, they were showing that the vaccine was working in quite a few, almost everybody, and yet only say 17% of people got a fever, for instance, after dose number 2 in the group of people that were aged 18 to 64. So even though not everyone had side effects in the study, we know that it actually worked for everybody, like up to 94% in the study. So you can be reassured that even if you don't get side effects, we have confidence that this is an effective vaccine, and that if you do get side effects that are expected, hang on, they should go away in a couple days. There is also some question about, hey, the second dose, I've heard it's way worse after the second, and I'm really worried about that. And it is true that our immune system has already been primed. It's already been taught a little bit about coronavirus. And so when we get the second dose, our immune system is kind of on high alert because we've already got one, and they're like, I recognize this guy, and we are really concerned about him. And so they react even more. The antibodies are already there, and our immune system is ready to go. And so our immune system actually demonstrates sometimes even more side effects than the first time. So I'll use myself as an example. The first time I got a sore arm, it went away in a day or 2, and it was all good. Second time, I was able to be vaccinated when a group of us healthcare professionals were vaccinated a couple weeks ago, and I got fever and body aches for a day and a half or so. And so I actually stayed home from work and I waited it out and it was fine. After a couple of days, it was completely gone and I felt much, much better. So be aware that there is a possibility that you might have a bigger chance of getting body aches and fever from the second dose, but those things should go away in a couple of days. And I wouldn't expect that anyone should be ill for more than 2 or 3. If you have symptoms that are continuing after 48 hours, you need to call and talk about COVID testing, because we don't want to miss something that might be starting to circulate in our town or in your community where you live. Also, I would emphasize that if you get any respiratory symptoms, those are not part of the side effects of the COVID vaccine. So we're talking about cough, shortness of breath, even a runny nose, a sore throat, those types of things are not expected from the COVID vaccine. And so please follow up with someone about that and consider getting tested for COVID.
We had a question from someone about, are they using people in the north to test the safety of the Moderna vaccine? Because it sure seems weird that we're getting it first with the vaccine and not people in crowded cities.
It's a good question, and I feel like I was just talking about this with some of my colleagues today at work. One of my colleagues is actually a healthcare worker that had worked in BC in a COVID ward, and I was asking her, a little bit sometimes about what it was like. And so we really are so fortunate in Yukon that we don't have cases circulating, but our healthcare system is really not as extensive as it is in the South. And so it's very concerning if you're living in a remote community. Dawson is fortunate that we have great hospital here and physicians that work here. We have communities in the rural Yukon that don't have that, and in other places in Canada across the north, fly-in communities. So lots of challenges when someone is really seriously ill. How do we treat them and treat them effectively? And so in the north, we know that we're more at risk for having a delay in our healthcare if we get seriously ill with COVID. So we want to make sure that we protect people in the north. So it's all about care and concern, and it's not about being experimented on at all. People down south want this vaccine, and unfortunately, we had a little incident in the Yukon a little while ago where that was aptly illustrated, where someone really wanted to knock on our door for a vaccine.
Here's a question from someone who wants to know, assuming I'm not immunized, could I get COVID more than once?
There is that possibility. We know that it has happened before. We don't know how often. I know back at the beginning of the pandemic, there was real concern with that. Because they were concerned, they were seeing it. And I think more recently, there's been more data out there that have showed that maybe it isn't the case, but I have also heard a 3-month time period. I have a member of my family that has a positive, they don't live in Canada, and they have a positive serology to it. And so the recommendation for that person is that they get immunized, but they might have a little bit of time. So maybe 3 months after their infection might be a time where we're not sure if the immunity is gonna last. So that would be maybe a goal point to maybe get their vaccine. So we're gonna be looking at that. We're gonna keep studying things. That's a really important point that people want to know. I know there's questions about, do we do blood tests that we can tell? In Canada, it's different than maybe down in the States where there's been lots and lots of infection, but we're gonna find these things out as we go along. The thing is, we have real concerns right now with COVID circulating in Canada, and we want to protect people as fast as possible and as effectively as possible. So even for folks that have had infection, we would like for you to get vaccinated as when you're well. We know actually there's other diseases, Wayne, where you can get natural infection and then that immunity goes away. Pertussis or whooping cough is one of those where we know that you can get whooping cough multiple times. So it's a wait and see thing for COVID-19, but there is concern that reinfection has happened before. Now, sorry, I was just thinking there might be questions about, well, what if I had COVID-19? Will a shot actually be a bad thing? No, it will boost your immunity that if you have some left, it will just boost that immunity and remind your immune system.
We got a question here from someone. If I get the vaccine and I already have underlying health issues, will I get sick?
So your underlying health issues will probably put you at greater risk for serious COVID infection. So for most of those folks, it's recommended that you do get the COVID vaccine. But there are some specific cases where you might have some special concerns and you need to talk about that with your healthcare provider, the person who knows your situation best. So when I would say underlying health concerns, that's a really broad area and it's pretty hard to address. It would depend on the situation and your health condition. So I'd recommend you talk to your physician. If you've already scheduled a vaccine and you want to talk about it with the nurse that you see, we have a lot of knowledgeable nurses that work at the vaccine clinics and they can answer those questions too. You can also call or email the COVID information lines and they can answer some of those questions as well. So there's some very common questions that we field a lot and there might be some really solid, easy, fast answers for you. If it's a more complicated situation, then that would be a case where maybe your healthcare provider needs to review that with you and talk about the risks and the benefits for you.
Okay. Got a few more. Well, we got plenty more questions here, and thanks for your time already.
Sure.
Variants, of course, another big issue we hear about lots in the news.
Yep.
How effective is the Moderna vaccine against variants?
So my understanding is that the Moderna vaccine has been showing some effectiveness, some pretty good effectiveness against the strain that was discovered first in the United Kingdom. And the numbers escape me. I think it's B1117 maybe or something similar to that. And then they've named the other variants other numbers. So for the UK discovered strain, we don't want to name it UK necessarily. It's not their fault or anything, but that one, I understand it's working fairly good against that strain. The others, it still remains to be seen. We haven't necessarily had a population with that variant exposed that has had the Moderna vaccine. So we have to have those two pieces together. Somebody who's actually gotten the Moderna vaccine and then exposed to that variant to prove that we actually are protected against it. I know that in research, I'm sure they're doing some studies about that because there's some things that you can do in a laboratory to put those two pieces together to test them when they're not even in a person, see how it works, how it fights it off. But I'm not sure, we're not sure yet exactly. And we're hoping, the faster we get a population vaccinated, the less we're going to be passing COVID around. And actually this passing of COVID around is what is causing these variants from person to person. Every time some person passes it to the next person, there's a chance for a mutation to happen. And that's why these variants are coming around. And that's why we really want to squash this quick so that we don't have more and more variants getting a chance to develop.
I'm not sure you have the answer to this question, but it's popped up in the Slido, and I think it's owed at least being asked. Why do the manufacturers of these vaccines patent them? Shouldn't they allow everyone to access the research so more vaccines can be made more quickly?
Yeah, I'm not sure I can answer that. Off the top of my head, I would say so more people can manufacture them. I don't know if I would want everyone manufacturing like a no-name brand of Moderna vaccine necessarily. I'd want to know that anyone who is manufacturing a vaccine has done it justice and is doing it safely and in the way that it really needs to be done. So patent-wise, I would also remind everybody, I don't want to get too much into the money thing and the debate about, pharmaceutical companies and money made, but it does cost a lot of money for these vaccines to be made. Usually scientific research is not a big money maker. And also Moderna has a lot of other studies on the go. It's really fascinating to look at their website because they have a lot of other cancer treatments that they're working on. And who knows, maybe this will actually fund some cancer research. Let's hold them to that maybe.
I have another question here from someone that says, if I've asked this before, just let me know. So, I've heard that many people died or got very sick after getting the vaccine. Why should we take a vaccine that might kill us for a disease that is like a bad flu?
So I guess I would differ on 2 points there, Wayne. One thing, COVID-19 is not a bad flu. I would say it's worse than that. I don't know how many of you remember the SARS epidemic or the outbreak that happened. I'm thankful that that was really able to be contained, but it was really scary. And so this is a little bit different, but it's a cousin to that. And it is also very scary. And I think it's hard for us sometimes when we haven't had anyone in our family that has had COVID and been seriously ill. But there are some people in the States who have lost a lot of family members to COVID. So I don't think that they would call this a bad flu. The other question you said, what was the other part?
Mathia has taken it off the slide.
Oh, okay. I'm trying to remember what it was. So, many people have died from the vaccine. I would also differ on that. That is actually not true. There was a question I know in Norway, and I don't even know if this was Moderna, but that there were some long-term care residents that had passed away soon after they had received an mRNA vaccine, I believe. But in the end, they looked at those deaths and they couldn't prove that that was actually related to receiving the vaccination. It was, I guess, determined that they had died of other causes. So there have not been any red flags for deaths that were attributable actually to the vaccine.
Here's a question that we all, I know we get asked this just about on a daily basis, is what happens if the Yukon reaches the target of 75% vaccination? Can we stop wearing masks? And if we can't, what's the point of taking the vaccine in the first place?
Well, this morning I had a chance to look or listen to Dr. Hanley's press briefing that he had this morning, but I know he did make a note in that today that vaccination rates will play a role in looking at lifting public health measures. Now, we'll also be looking at what's going on in our neighbors' worlds, like in British Columbia and Alberta and places where we know people will continue to come and visit us from. And we will also want to make sure that we're not seeing, like if we do have another case of COVID, and it's not unlikely that we will probably see another case or two of COVID in the Yukon, maybe more, that we're not seeing it, a big outbreak of it. So there's a new vaccine tracker on yukon.ca. I don't know if any of you guys have checked it out. It's kind of cool. It'll give us a little scoreboard maybe of how we're doing. We have been saying this from the beginning of the pandemic, that when we have a vaccine, it's really going to make a big, big difference in what we have to do. So just hang tight. We do still have to keep masking and stuff. Not everyone is immunized yet. And we need to be careful that we do this together. It's kind of in solidarity, but also because not all of us are vaccinated yet. And we want to make sure that we are protecting each other until it's time. And I have hope that that's going to happen. I don't know when yet, but hopefully soon.
We're down to just a couple more questions.
Okay.
Do we know yet if immunized folks will require boosters for COVID over time?
We don't know that yet. This technology, this vaccine is actually so amazingly effective. 94% is really, really good in immunization world. It's amazing. And so I hope that is something that's a good, it bodes well. Our flu vaccine, which I do every year, I take every year, is only 60 to 70% effective for normal, healthy adults that are not older. So this Moderna vaccine is way more effective. And I hope that will mean that it'll also have some long-term effectiveness. But we just don't know yet because we haven't had the time to see long-term what's going to happen. Now, I know that there's also questions about variants and booster doses may be connected with that. And the really cool thing about mRNA technology is that they could easily change that chocolate chip cookie dough to, chocolate and butterscotch instead. And so maybe we'll have to have a booster dose if we find that variants are circulating more than we'd hoped, and that we have to be protected against something maybe in addition. But that's all in the future. We don't know that. Hopefully we can squash COVID enough that these variants aren't going to be as much of a concern, and then we'll see.
I think I have one more question, and we talked earlier on about how to address some of the issues around, you know, the pandemic being used as a scare tactic to restrict personal freedoms, and whether or not the virus was engineered by the Chinese government as a way of spreading fear and controlling the world economy. And maybe Dawson's public health nurse is the right person to answer that question. But one question we did ask this morning, I'm going to ask you again today, is does this vaccine have a microchip or some other tracking technology? Because there are people who are concerned that someone might be using this vaccine to access their biological information.
No, it does not have a microchip in it. Definitely not. I have full confidence in that, and I've chosen to get it twice. I'm fully confident it does not have any tracking ability at all.
If people had more questions about this and had, you wanted to do a little bit more research from reputable sources, or any that you could recommend for folks?
So, I mean, in the Yukon, we've got our homegrown Yukon.ca, and it's got lots of great information on it. There's also lots of information on Health Canada's website. Another go-to that I use when I want to know about immunization information is our National Advisory Council on Information. So NACI is the way we say it, NACI. So you can look at that. There's also, we say FAC or PHAC, sometimes the Public Health Agency of Canada. Those three are the big three, I would say, for vaccine or immunization information in Canada. And those are very reliable websites. There's other reliable websites that come out of the States. Just be careful when you're reading something from another country that they are also addressing their country's situation and not necessarily our country's situation. But that doesn't mean that there's not some good information out there. WHO, the World Health Organization, also has information on their website. They've actually got some really neat Science in 5 videos. If anybody's not a really long, they don't want to watch long stuff, Science in 5. Look it up on YouTube. There's some really good WHO knowledgeable doctors talking about coronavirus and the pandemic and vaccination. Yeah, so generally speaking, when I look at reputable sources and I tell my kids which ones to look at, usually government agencies are the first ones to go to, like the health government agencies. They're the most reliable, and they're the ones that have the experts in these fields, and they know a lot of they know their stuff. And then research papers from universities might be a good place, but with the pandemic, my go-to really is those three in Canada: Health Canada, Public Health Agency of Canada, and National Advisory Committee for Immunization, and our own Yukon.ca.
If someone who's watching this video, maybe in another community, has a few more questions about the vaccine, what direction would you point them in?
Well, if I would try the website first, because we want to answer everyone's questions, but in some communities, you only have 1 or 2 nurses working there. So I don't want to overwhelm them with lots and lots of questions. But if you have some complicated questions, or you have questions specifically about your healthcare or your health situation, maybe your visiting physician that comes to your community can answer those, or maybe the nurses that work in your community can answer those. In Whitehorse, if you live in Whitehorse, you might have a family physician. There's also the COVID-19 information line. There's a phone number on the website. Maybe Mathia can post that. And the COVID-19 information email address as well is another thing that can be posted. And then in Dawson, I would start maybe first there, but we have a lot of great physicians, and I have a couple nurses working with me that can help answer questions. And like I mentioned, if you're going to a vaccine clinic, the nurses there also can answer some questions, and we have some top-notch nurses working there. And so in Whitehorse at the clinic there, and in here in Dawson and around the territory as the vaccine team comes, they're also a good go-to place. We're going to be vaccinating next week in Dawson, and so I hope we'll see a lot of you out there. If you live in Dawson, please come out. It's actually kind of cool because you get to see people you haven't seen for a while. I really enjoyed the week that we had the team here, the first team, the first time. And the team that comes to us in Dawson is amazing. They're really friendly, and they'll make you feel welcomed and hopefully put some of your fears at ease.
Wonderful. I think we've used up enough of your evening. Thank you so much for sharing your calm perspective on such a challenging topic. We really appreciate that. And we'll be sure to post all of the links and the answers to the questions. The video will be shared on One Yukon, and it will be distributed widely throughout Yukon. So thank you again, Kunishjish, and enjoy your evening and long weekend.
Thank you very much, Mathia.